So this is the age distribution of the whole study here. This is the age distribution of the women that were reported to be Métis or First Nation in the study. So we have a relatively good representation of all ages. But as you can see, the average age is younger. So we don't have a lot of women that are over 54, 56 years of age compared to the general population. So it means that this population is younger, and that will have an impact on the result that I will show you after. So this is how these women were infected with HPV, NA type of HPV. So in the study population, so all participants, in fact, it's 14%, it's not 19 as it's written there. And among the Métis and First Nation, it was 33%. So we see a big peak, exactly like the other one we see. And a second one, what's special about these two peaks is that this one is much higher than the other one. This one here goes approximately up to 60% of women infected when they're young. It goes up to 80%. And when they get older in the general population, it goes around 20%, while in fact here it goes up to 60%. So whatever the age group, it seems that the Métis and First Nation bear more HPV infection. And this is exactly the same graphic that I just showed you before. So I don't want to spend too much time on it. But again, we detected HPV 16 and 18 here in the younger population, as well as HPV 6 and 11. This is a relatively small sample. That's maybe why we don't find it when we, for the other age groups, so that may explain it. And this is a graphic that represents the distribution of all the HPV types in the population of we investigated, so Métis and First Nation. So again, you have the four types here that are targeted by the virus that are there like in any other population. So Isaac was talking about HPV 31, which is this one here, which is relatively small in this population, but HPV 35, HPV 51, and HPV 58 are relatively high. What is the meaning of that? We absolutely don't know right now. So these are viruses that are involved to some extent in the risk of developing a cervical cancer, but what is their exact role? We don't know as much as we know it for HPV 18 and 16. So now I'm just comparing the Métis population, so the survey for the Métis and First Nation population to the other Manitoban that were participating in the study. So what we see here is that the risk of to have an HPV infection was higher if you are a Métis or First Nation. Your financial situation was a bit worse when it's more difficult or moderate more often when you are a Métis or First Nation. Métis and First Nation smoke a lot more. 61% of the women that attended the clinics were reported to be smokers, current smokers. No difference for the number of Pap tests reported, almost nothing. So it seems to be, and it's very high, but almost no difference at all. For the number of sexual partners over last year, so the proportion that reported no sexual partner at all was, I have to hold this mic too? Oh, okay. Okay, I can do that. So it was about, I suppose it's much better like this. Huh? Yeah. And so the same number had approximately, same proportion, approximately no sexual partner, but First Nation and Inuit, First Nation and Métis reported a greater number of 3 or more sexual partner over last year. But you have to remember that this is in a younger population, and this is what you expect of a younger population, of any younger population. And more of First Nation and Métis were also reporting not being a stable relationship. And that's what you expect too when you are younger. So we took all these different variables, put them in a model, and tried to see what would predict the best the risk of having an HPV positive diagnosis. And what we found is that age was a predictor. So the older you get, the less at risk you are. The number of sexual partners you had last year was a huge predictor of your HPV infection, and your ethnicity. So to be Métis or First Nation or increase your risk. So what's interesting in that is that when you put these variables in this model, you kind of control for all the other variables you are interested with. So, and these factors become independent factors. So, and so it's not because they're richer or poorer, younger or older, or so it seems to be the fact to be Métis or First Nation seems to be an independent risk factor for getting an HPV infection. And just to point here, and I'm finishing with that. So it's things that I wondered when I was finishing this study and writing it. I just wonder, and I have no answer really for that, I have to admit. So, my two question was, do we have here different susceptibility in these populations, different susceptibility to infection, to HPV infection, or this second point that was brought yesterday by, we had a dry run for this presentation yesterday, and someone in our team came with that point, and I thought it was a very good point. So when you are established a steady state of infection in the population, for example, if you had 10% of infection or 20 or 30% of infection, so if you enter that group and you start having a sexual relationship, then your risk will be totally different. So you may have a 10% chance if you are a 10% group, and it would be very difficult to live that kind of rate that's already established in the population. So, yeah, that's it.
We're just gonna switch gears a bit. Can you hear me? From research to resources, I think. And to help us get started with that will be Martine Dubuc. Is that right? Am I saying your name wrong? Close enough? Yeah. Who's the immunization nurse advisor to the Communicable Disease Control Division at the First Nations and Inuit Health Branch. Martine completed her Bachelor, I don't know actually, of Science in Nursing? Okay, I'm sorry. At the University of Ottawa. Her career path has included being an RN for the neonatal intensive care unit at the Ottawa General Hospital, the director of care for a retirement home, a case manager for home care, and most recently an occupational health nurse in the Workplace Health and Public Safety Program at Health Canada. Martine brings a wide variety of nursing experiences and perspectives, as well as an enthusiastic approach to teamwork to her work at the immunization program. Thank you.
Well, thank you everyone for having me today, Colleen and the NAHO staff. I'd like to acknowledge that we are on Algonquin territory, and thank you for that. So today I will be speaking about this. Let me just fix this. This is an HPV in Aboriginal woman online education course.
What's going on? Talk to me. We lost our mic. Sorry. One mic is mic'd for the room and one mic is mic'd for the camera.
We can lose the camera.
Is that better?
Okay, is that better? Okay, good. So earlier this year, Health Canada launched a free, accredited, bilingual online continuing education course for healthcare professionals. And it deals with human papillomavirus and Aboriginal women in Canada. The program was developed in collaboration with the Society of Obstetrician and Gynecologists of Canada, as well with the MD Briefcase, the company who hosts these types of courses online. What about the course? Well, the HPV course was entitled HPV and Aboriginal Women in Canada. It aims to help physicians, nurses, pharmacists, CHRs, commonly known as community health representatives at the community level themselves, to learn more about the unique needs of Aboriginal peoples and the determinants of health of that population. But more specifically, this course was tailored to address the determinants of the HPV infection in the Aboriginal populations, the prevention, the treatment of HPV, as well as how to communicate with patients to improve management of the infection within the First Nations and Inuit communities themselves. So how to make it more culturally relevant once you're out there in the field. Some more about the course is that it's a self-learning session in hours length, which just means that people can register online and they can take the course to their own beat, do a couple of modules, and then come back to it when they have the time, so it's not time restraint. It also presents an opportunity to interact with faculty and other participants through discussion boards, ask the experts, and what the best part is they can share best practices and practice tips on a bulletin board. So, participants can share ideas and information about what they know and what they think works for best for them in their communities. And they are free, bilingual, accredited, which means that a healthcare professional who needs to show their licensed body that they are keeping up to date with current information, so that credit can go towards that perspective. So that's also a bonus for the healthcare professionals who are looking to learn a bit more. And it's open 24 hours a day because it's online, and it's good for a year. The idea behind the course, how do we come up with this? Well, there was a famous dialogue that happened in Winnipeg back in December 2008, and entitled Improving HPV Prevention Among Aboriginal Peoples. And in that workshop, many people from different organizations, governmental, not-for-profit organizations, sat together and had a discussion. And they discussed the need to share current information, how to adjust the public awareness strategies, the best practices regarding immunization program implementation, as well as gaps in the existing research. And out of this discussion, 11 key issues came out. And priority needs were also identified. And so we've taken this discussion and kind of helped build that idea that maybe an Aboriginal online course would be needed for this population, because like Dr. Paulette Tremblay and Isaac Sobel very well mentioned, there's a lack of information out there, so we need to make something. So that's how we thought about making the course. And who made this happen? Well, to start, faculty members were chosen on a national basis, and they were chosen based on their expertise and on their leadership of HPV knowledge. And they were asked to participate as an expert review panel. So their job was to provide advice, assistance, provided input and direction on the HPV case study, provide support information, so both practical and relevant to the healthcare profession itself. And all these comments and advice was rolled up into a main medical writer who for this course was Dr. Dawn Wilson from British Columbia. That's it for this. So before the course was launched, it was important for us to just not go ahead with the course without knowing what exactly people would want to hear or learn about. So we actually launched a national needs assessment to help us guide the need or what people want to hear. So we did that to gauge the value and interest of the course, and it also provided us a baseline for the online course baseline objectives. And with that information, we were able to tailor the course for the healthcare professionals, especially the ones caring for the Aboriginal patients residing in geographical remote and isolated areas. I would like to, she's not here, but a special thanks to Dr. Paulette Tremblay. For this course, she was named the lead reviewer for this course, and because of her perspective and contribution, the course explored approaches to improving communication for better HPV prevention and management among Aboriginal peoples on top of all the usual clinical clinical epidemiology, how the disease manifests itself, all the clinical side, she added a new perspective and a new dimension to the course, which makes it more culturally relevant for us to learn.